Welcome to our quarterly Arizona Community Roundtable interactive broadcast today as we advance sickle cell disease issues, education, and empowerment together, and celebrate the month of September as National Sickle Cell Awareness Month. Today's broadcast will be hosted by Courtney Slonacker, Executive Director of the Red Cross of Southern Arizona, and Lucy Howell, CEO and co-founder of the Force for Health Network, and will feature an executive panel of experts that include Moses Akpan from the Sickle Cell Foundation of Arizona, Cindy Komar from the AZ Blood Alliance, Sarah Speakermeyer from Banner Health Family Care Plans, Erica Lassiter from the Kwame Lassiter Foundation, Fran Altmeyer from the Arizona and Department of Health State Screening Labs, and Dr. Robert Gilio with the Force for Health Network. Today's live broadcast will interactive, so please engage with us at our Facebook, LinkedIn, YouTube, or from within the 360 SCD Hub site or app to be eligible for in-show prizes sponsored by Banner Health and Pfizer. And special thanks to the Force for Health Network for producing this event. Now let's meet our hosts, Lucy Howell and Courtney Slonacker, to kick it off.
All righty. So welcome, everybody. It is the end of September already. I cannot believe it. But rather than, I like the idea of celebrating a National Awareness Month at the end of a month, Courtney, right? Because it really is about carrying the momentum of what it is that we're trying to do. So welcome to our quarterly Arizona Community Roundtable, Advancing Sickle Cell Together. I am your co-host, Lucy Howell. I am the co-founder and CEO of the Force for Health Network, and I am joined with my partner in crime here, this Courtney Slonacker, who is the Executive Director for the Southern Arizona Red Cross and New Mexico region, et cetera, right?
Yes. Thank you, Lucy, and welcome to everybody. Thanks for joining us. And like Lucy said, we really want to carry that momentum forward with Sickle Cell Awareness Month. And, I was really reflecting on the work that all of our organizations do. And much more than a celebration, I think it's honoring our sickle cell warriors out there that continue to battle through this disease. And that's what brings us together specifically in September. But it's really to honor those individuals, the folks that have passed before us, and to continue that momentum is incredibly important. So Lucy, thanks so much for hosting us.
No, I love it. And, we've got an incredible planning team, and we're going to be bringing them up one by one, and then we'll kind of form this community roundtable. But before we go in there, the reason why I'm doing this is because I'm just so inspired by, health science. And when you can look at the molecular structure of blood and understand that it can give life, right? And that a deformity in that cell could cause complications. And I've learned so much about this disease, sickle cell, as we've worked with the Sickle Cell Foundation of Arizona throughout the year on this 360 SCD Hub app. And so it's great. And I want to kind of gamify this concept of, learning and living and sharing it. Right. So this is meant to be an interactive broadcast. We are live on LinkedIn, Facebook, and YouTube. I'm going to be navigating comments here. So if you happen to be watching live and you've got a question or a comment, please go ahead and pop it on. And if it makes it to the stream, you may be eligible for a prize giveaway throughout the show. So that's me. And before we kind of get kick-started, Court, resiliency, SCD, and blood. Kick us off here. Why are we doing this again? What's your focus from the Red Cross perspective?
Yeah, thanks so much, Lucy. And as many of you know, sickle cell disease is the most common genetic blood disorder in the U.S., affecting about 100,000 people, primarily of African descent. And when the American Red Cross provides 40% of the nation's blood supply, a little over 40% now, and it is incumbent for us to provide a diverse and stable blood supply specifically for sickle cell patients. And when the Red Cross looks at, it's not simply about collecting blood, right? It's about collecting the right types of blood, engaging the right community members, and asking the right people to donate. 1 in 3 African-American blood donors are actually a match for people living with sickle cell disease. And if you don't know, many of our sickle cell warriors will receive hundreds of transfusions throughout their sickle cell journey, requiring a very specifically closely matched blood product. And the only way for us to do that is through engaging, building trust, and really connecting with a diverse group of donors. And for a long time, the Red Cross blood donor database was pretty homogenous. And so one of our big focus areas over the last 5 years has been diversifying the blood supply. And we have a specific program within that is our sickle cell initiative. And that's what I'm here to talk to you about today. You're going to hear from one of my sickle cell colleagues, Crystal Jackson, about the importance of donating blood, marking your race when you're donating blood. So when you're filling out that health history questionnaire, there's an opportunity to mark your race on there, so that we can also, we do sickle cell trait testing as well. And the Red Cross is really focused on diversifying the blood supply so that we can build a more resilient community. And for us, resilience looks very different for each community, for each individual. In our blood collection space, resilience means to me and to our organization that we have the right blood product on the shelf at the right time, so that no patient, no family member ever has to hear that their care has been delayed because we don't have the right blood product. And so having a resilient blood supply starts with a resilient and a consistent blood donor base. And that's what we're here to do today. That's what all of our fabulous partners have been advocating for, is really engaging with our community and stabilizing that blood supply, and specifically diversifying it so that our sickle cell patients never have to have delayed patient care. They always have the right product on the shelf when they need it. And that's why we're here today, is to build that resilience. Our sickle cell warriors, have to face so many different uncertainties and challenges throughout their sickle cell journey. The least we can do as a community is roll up our sleeve and donate blood, and do it consistently. It's the blood on the shelf that's going to save someone's life. It's not the afterthought once you see someone needs a blood product. It's before they need it. So my ask to everybody listening and tuning in is to roll up that sleeve, donate consistently, donate often, and you just never know whose life you're going to impact with that blood product.
I love that. And, I don't see Crystal Jackson on camera or mic, or else I would bring her in. But, I'm here to let's make Arizona the best in the country, right? I'm all about gamifying this baby. So I love that we've got statewide leaders across the board on this. Like I said, we spoke about resiliency. If Crystal comes on a little bit later, she can give specific blood campaign updates in the state. We are still waiting for Moses, right? So we will kind of go right through. It is Sickle Cell Awareness Month. We have both a national proclamation from the White House, and then, of course, Governor Hobbs at the state level has recognized Sickle Cell Awareness Month during the month of September. So we honor that. And it goes right to our next speaker, really. And I'll just go straight to Cindy here, because let's see if we can bring Cindy up, because it really is about advocacy. We wouldn't have those proclamations if it wasn't for folks like Moses and Cindy. So I'd like to introduce Cindy Komar to the executive panel here. Welcome to the show, Cindy.
Hi, thanks for having me. Hi, everyone. I'm very thrilled and excited to be here.
Wonderful. And part of the role that you're playing on the team, everybody, population health is a team sport. Everybody plays a role. And one of the things that you've done so well is at this advocacy piece. So talk to us about tell us a little bit about Blood Alliance, right? Arizona Blood Alliance, and then why you think advocacy matters.
No, absolutely. The Arizona Blood Alliance was created to provide education, advocacy, and support for those living with inherited blood conditions in Arizona. So that includes sickle cell, hemophilia, von Willebrand's disease, and other rare blood conditions. And the reason why we brought everyone together is that while there's differences among the different conditions, there's also a lot of similarities, and trying to leverage those similarities where possible. And one of those areas is advocacy. No matter what chronic health condition you have, you still face the same issues with regard to access to care, to navigating the insurance, to making sure that you have a provider that'll listen to you and be a team player with your care. Also, these conditions are all genetic, so they all are from birth on. And what happens is it affects the entire family. So it affects the siblings, it affects the children, it affects the parents and the caregivers. And so we feel that we bring everyone together for the entire family to provide that education, to help empower them to feel like they're more knowledgeable. Knowledge is power, so that they feel more comfortable in managing their chronic condition and navigating through the insurance maze, the education system, all those things that they need to do to make sure that they have access to the care that they need. And then in terms of advocacy, which is something that I'm very passionate about, really there's a need to create greater awareness among the general population of sickle cell and the needs of those living with sickle cell. As well as to educate those with sickle cell how to advocate for themselves, how to speak up and make sure that they feel comfortable and empowered to ask for what they want and ask for what they need. So a lot of what we do is work legislatively to make sure that we talk to legislators, we talk to the governor's office, we talk to other agencies like Access and ADHS and those other departments to make sure they understand what sickle cell is and what the needs are of the community, so that we can help make sure that the policy helps meet those needs. And then the other thing that we do is community support. So we bring people together so that they can get to know one another. So again, it takes a village, and once they get to know each other and build their own support system.
Lucy, I'll jump in for a minute, but working with the Arizona Blood Alliance issues, I think Cindy was about to talk about that support network, and I think that's what is incredibly important for all of us to come together, is to build that support network, to build those alliances. When I think advocacy, and I think many of us in the community, if you're not in the policy space, right, at the local, state, or even the federal level, it can be quite intimidating, but it really is a simple phone call or a simple letter to your representative, whether that's local, city, state, or even federal. It doesn't have to be as intimidating as it sounds. And I think the Arizona Blood Alliance has done a really great job of educating people how to advocate, how to work with your elected officials, and really remove the fear from it. It's not as scary as it seems. Surprisingly enough, our elected officials are people too, and they do care. But a lot of times, the issue is a lack of awareness, a lack of education. And so the more voices that we have working together, sharing the same message and sharing that same drumbeat, you got to create that muscle memory, right? And it takes you saying things a few times, knocking on the same doors a few times to really see that movement. So I'm speaking on behalf of Cindy, but just knowing the great work that Arizona Blood Alliance does, they're continually knocking on doors, sharing the same message, so that we can start to see some changes at different policy levels.
And I think that another thing that, we learned about Cindy, and this is when we met, the Arizona Blood Alliance, along with Sickle Cell Foundation, along with Banner, along with Pfizer, many of the same, folks here actually host an annual family conference. It was awesome to see families with their kids in kind of a corporate conference type of setting. This was held up in Phoenix. So I think that that's a wonderful thing. So hopefully Cindy will be able to jump back on so that she can participate in the next conversations. But let's go ahead and keep moving to our next superstar executive panelist to the stage, and we'll bring Sarah Speakermeyer. Sarah, it's good to see you.
Good to see you too, Lucy, and hi, Courtney.
Hey,
Sarah,
welcome.
Sarah currently is on the board of the Sickle Cell Foundation of Arizona. She was very instrumental in being part of the planning team for the 360 SCD hub that we have developed together, but she also is the Chief Operating Officer for Banner University Family Health Plans. And so she has an incredible perspective of those in need of care and is actually currently serving over 300,000 patients, right, throughout your market footprint, and specifically about 300, 400 patients here in the state of Arizona, right?
That is correct. Yeah, we have close to 300,000 members. We are an access plan, which is Banner University Family Care, and we also offer a Medicare Advantage plan, so our Banner Medicare Advantage. So those combined, we cover close to 300,000 lives in 10 different counties within the state, and we do serve several hundred sickle cell members that are members of our plan.
And, you know, I asked you to speak on advancing together, you know, as your executive welcome. You know, what say you?
Yes. Advancing together. I love that you picked that topic for me, Lucy, because it is all about our community voice and having that voice and bringing it one step at a time. At the family conference that you referenced, which was an amazing experience to be able to come together with the families and sit there with them and hear their stories, to roundtables like these, and then even gives us opportunities of these different partners that you see down on the screen to even get our voice out there nationally. So it does take a community and it takes partners. You see many of the logos there on the bottom of the screen, but definitely a huge shout out to the Sickle Cell Foundation of Arizona with Moses and Lucy, you and Dr. Rob from Force for Health, but American Red Cross and the Arizona Blood Alliance, Arizona Department of Health, Banner. There's so many that when we come together as a community, we make a larger reach. So it's great that we're able to come together because we're doing this. We are advancing this message together, and we look forward. This is just one step, right, Lucy and Courtney? One step of getting that message out there. We're excited to be able to bring on more statewide partners and continue to bring that voice to that national level as well.
And I'm not going to let you get away without getting to brag about the fact that, you know, within the year of working on this, getting together and why togetherhood and partnerships matter, you know, you were able to present this to National Innovative Medicaid Leadership, right, at a conference late July. Quick comment here.
Yes, no, yes, that was our first time nationally being able to share this, and been there with you and Moses so many times locally, but it was amazing. I was in Virginia, Alexandria at the Medicaid Innovation Conference, which has Medicaid plans and state and federal officials from all over the country that came, and it was an honor to be able to present that and share Moses' story with everyone else. And I had so many people from the room come to me after saying, this is amazing. We need to know more about this app, because it really is about putting those resources together in one spot on their phone, and they're able to connect with each other, connect with the community, document their symptoms that they can take to their visits when they're speaking to their doctor. So it's a great tool for all of us.
And Sarah and Lucy, I have a question for both of you. Can you talk a little bit about, you know, the innovation that you're seeing kind of in the healthcare space? And Lucy, from your point of view, the digital world, right, is something that we're all continually adapting to, but you've really come up with some innovative solutions through the Sickle Cell 360 app. Can both of you touch a little bit on that?
Sure, I could speak to it from a health plan, healthcare lens. I mean, definitely engaging with our population. You know, before COVID, it was a lot of in person, and we started layering in some technology and some apps, which, you know, you don't always see as much engagement on those quite yet. Then we got into the COVID world, to where everyone's going virtual, and we just saw more and more of a need. And that's what I love about Moses' idea around this, because he saw that challenge that he was experiencing with this foundation and connecting with this community. And I think what Lucy, I've seen you bring that together, of the importance of not just the app, but that community connection as well. So we're kind of bringing the two together, the in-person from our last roundtable that was in person, and the family conference, to now where we're doing it virtual and you have the app. So where the success of that is bringing both of those together, and we're seeing so much engagement from that.
Well, that's awesome. I'm going to just pause and not even answer that because we're running a little bit late, but we're going to get the gist of everything. And our fearless leader is finally here. So I'm going to go ahead and introduce him to the stage. Sarah, I will be bringing you back here in a bit. See you in a second. But, big reason why we are here is because we have all been so inspired by Moses Akpan, his personal story, his professional story, his passion. And so, Moses, welcome to the broadcast. I know life happens, and we are so glad that you were able to join us. So, I give the baton to you because I did mention a little bit that it was Sickle Cell Awareness Month and that we had our proclamations intact. But I hand it to you. What's your executive welcome to this wonderful group for this quarterly roundup?
Wow, this is incredible event. If I said a dream does come true, and indeed dreams do come true. Sometimes it's hard to see the forest from the trees. Sometimes it's hard to even see the future. But it's amazing. From the humble beginning, the journey to see Courtney, to ride the waves of the Red Cross, to see Sarah, to ride the waves of Banner, to see Cindy. I don't want to leave anybody out. There's so many folks that I need to recognize: Banner, PCH, Arizona Department of Health. Oh, I don't want to leave out the doctors' names, that I must be thankful to the board of the Sickle Cell Foundation that came together and give hope to this effort. So never thought that we would be here today from where we started, but there is always hope if you do the best you can. So I want to thank everyone who is here. We're celebrating Sickle Cell Awareness Month. My gratitude goes to the Office of the Governor, who recognizes Sickle Cell Awareness Month and celebrated with all of us, in fact, with the whole state. I don't have very much to say. I'm overwhelmed. I want to recognize Rob, Dr. Gilio. I want to recognize Lucy. I said there are a lot of decisions that we make. Sometimes you don't remember you think about the bad mistakes, the bad decisions that you make. But I think partnering with Force for Health was one of the good decisions that we made.
Aw, thank you.
So I call her my sister.
Well, Moses, I love you, and you know that I really am passionate about helping those who are passionate about health issues. And so that will kind of conclude our executive welcomes from the group. Everybody stay where you are because I'm going to be bringing folks back up to the deal. So we are going to be moving to our first topic, which is what is sickle cell and why should we care? Before bringing Erica Lassiter out, though, we wanted to go ahead and just play this quick 4-minute video. It is a medical minute video from Dr. Rob. Now, if you were to watch this on the 360 app, you'd actually earn points. You need to earn your badge. But, let's just go ahead and set the stage right here so that everybody can have a general basic foundation of what sickle cell is. And then we're going to go ahead and invite Miss Erica Lassiter up on the stage. We'll be right back.
Hi, it's Dr. Rob Gilio with a Medical Minute introducing sickle cell disease. It's a worldwide problem, primarily in equatorial or warm climated regions. The areas here in red indicate areas that are of highest prevalence, but if you have a relative or an ancestor who once came from any of those regions, you are at risk. The risk of carrying the trait is relatively small for Caucasians, but for Blacks and Hispanics, it's higher. Approximately 10% of Blacks can have the sickle cell trait. There's 100,000 people in the United States currently carrying the disease. 90% of them are African American or Hispanic Black. Sickle cell disease occurs in 1 out of every 365 Black or African American births and 1 in 13 children of someone who is Black or African American is born with the trait. If you have the trait and only one parent has the trait, there's only a 50% chance that your child will have the trait and a 0% chance of having the disease. However, if you and your partner make a baby, you have a 1 in 4 chance of a baby having that disease, a 1 in 4 chance of the baby not being a carrier, not having the trait, and not having the disease, or 1 in 2 chance of the baby being a carrier. What's the issue? The issue is the cells get out of shape. If you have the wrong gene, you make the wrong hemoglobin protein. That protein changes shape with low oxygen. That change of shape changes the shape of the cell, and that change of the cell clogs things up. That clog can cause something called a thrombus, seen here in the lower right, which blocks the normal blood flow seen in the upper right. What does that matter? Why does that matter? When blood flows, it provides oxygen downstream. It goes to every organ in your body. If a branch is blocked, whatever's downstream from that branch will die or suffer or not work well. It's the same as what happens with a heart attack. People that are older that get sickle cell can have the complication of having thick plaque in their blood vessels that make it even worse. So sickle cell can affect the entire body. That's why you should have a specialist with a medical home frame of mind, because you might have complications of the eye, the liver, the lungs, the chest, the kidneys, foot ulcers, or other such issues that are called crises. Have a medical home, has a doctor and a team that can coordinate your care. Key takeaways to know: it's not contagious. Don't stigmatize it. You can't catch it from someone. You can inherit it is the only way to get it. Screening for inheritance risk and screening for disease is available. Sickle cell disease is not currently curable. It might be in the future, but right now it's only treatable. Dehydration, cold temperatures, and avoidance of colds and flus and pneumonia can help, because these lower your oxygen. Those change the shape of the blood cell. The sickled shape cells clog blood vessels and can cause painful crises and other events that affect parts of the body. If your doctor is not familiar with sickle cell or doesn't look like you, especially, ask them, could these symptoms be from sickle cell? Put the thought of that in their mind. It might affect how they treat you. There's an app for the doctors as well as for you, 360 SCD Hub. It's free. There's an app in community with the QR codes. You can download it if you wish. Get smart about sickle cell. Share this app, share this link, share this video, and become someone who is kind and doesn't stigmatize, but supports those with sickle cell with knowing their knowledge and, if possible, blood donation for any cause, including for sickle cell. Thank you for taking this Medical Minute with Dr. Rob.
Okay, so now we all know, right? You can't catch it from somebody, right?
Right.
There is a misshapen form that will cause pain of blockage. So just understanding that may increase some empathy, perhaps, and some awareness if you are coming into contact with youth, students, adults that are perhaps suffering from sickle cell. Courtney, before I add Erica, go ahead.
I was going to say, what a powerful message too about the stigma, right? Pain is something that we can't see. And, you know, whether you're a medical provider, you're a family member, you're a friend, it's a really important reminder that you can't see their pain. We can't feel their pain, but knowing just how this disease really can wreak havoc on your internal systems with no outward visible signs. And that requires, I think, the utmost empathy and concern for our sickle cell warriors. So really good reminder from Dr. Rob. Thank you.
And I think that that's the perfect segue into our next guest, Erica Lassiter. I'm going to bring to the stage. She sees this from so many different perspectives. And I'm trying not to, well, first of all, Erica, welcome to the show.
Thank you.
Hi. Little background noise, but that's okay. I'm going to pull this off. So Erica is also involved with the Sickle Cell Foundation of Arizona. She also has and started her own Kwame Lassiter Foundation as a legacy and memory maker for her late husband. And she also sees this as a mama of, somebody, her son, who will play a video for you shortly here. Let me see if I can get this off. Sorry about that. So I can bring you up to speed. And Erica, I almost want to go ahead and start this segment off by showing the video that Channel 12 did of your son. Would that be okay?
Yeah, we don't have any background noise going on, so I don't know if it's an echo. Do you still hear it before we go any further?
I do have a little echo.
I don't know where it's coming from.
I don't want to cause too much grief around it because it's so important. I want to get to this, but let me go ahead and grab this. Now you guys should be able to see this without the ad. And I'm going to make this full screen. And hopefully you guys can hear it okay. Let's see.
Nice to meet you. Thank you. Hi. Nice to meet you. Thank you.
Hugs and tears as two families finally meet. 20-year-old Quincy Lassiter face-to-face with 24-year-old Bree Randall, who saved his life with her bone marrow donation 4 years ago.
It's probably been like all my life in and out of the hospital.
Quincy spent most of his life battling sickle cell disease. It was excruciating.
It was just like a lot of pain and so mainly my back area or my legs. It just starts slow. Like you can know when it's coming on, and then by the time it hits its peak, it's really bad to where you're in tears.
For the son of the late Arizona Cardinals player Kwame Lassiter, that meant missing out on a lot of family fun.
I used to golf with my dad, but my back I didn't have a good back.
Sickle cell is a blood disorder. The only potential cures are stem cell or bone marrow transplants.
Normal people's blood cells are like a full circle. People with sickle cells like a crescent shape. When the cells don't get enough oxygen, it causes a crisis in certain areas.
Even with 8 sisters and brothers, one of whom is his twin, Quincy couldn't find a match. But hundreds of miles away on a college campus in Texas, Bree Randall was signing up on a whim to become a Be the Match donor.
So my friends and I were walking from band practice, and the people at the tent were super friendly, and they were like, "Hey, do you want to swab your cheek real quick? You could be someone's perfect match and save their life." And I was like, "Okay, yeah, that sounds awesome." And they were like, "You probably won't be anyone's match, but it never hurts to try."
They were wrong, and Quincy's first donor had backed out at the last minute.
And they were like, "You're this guy's perfect match. Would you like to donate?" And I was like, "Yeah, 1,000 times yes, I'll do it." Oh, there you are.
Quincy got to meet Bree in a place that means so much to his family, the home of the Arizona Cardinals, the team for which his dad played.
We both were like, "Thank you." And he was kind of like, "Why are you thanking me? You did it." And I was like, "I know, but you gave me the opportunity to do it. And you and your family reached out to meet me. So it's thank you for this. It's a big part of my life as well."
I was kind of blessed to get two donor calls, even though one fell through. Some people get 0 calls, and it changed me and my family's life.
Now, come on. I'm going to be crying here.
I am. I tear up, and I hadn't seen that video in so long, and I literally am trying to fight back tears right now.
Well, thank you so much. And Quincy, and so glad to see you, and welcome to the show. You and your mama have the topic of what is sickle cell and why should you care? And this is really messaging to the general community. So beyond what we just learned about you in the story, Erica, tell us a little bit about yourself. How does this disease affect you and your family? And, to the extent that you'd like to include the Kwame Lassiter Foundation legacy and your husband, start us off. Tell us your story.
Yeah, so I was born with the trait. My mother did tell me, much like the doctor just shared, that I had sickle cell trait all my life. My husband did not know that he had it, and this is my 1 in 4 chance sitting here right here with me. And when we did find out after my first was born, he's a twin, and he's the youngest of my twins. And I was praying that I wouldn't get that news, and just a day after he was born, I got that news. So since he was 7 months old, and it started to show itself in the his hands being swollen, his feet being swollen, the tears not coming from nowhere, knowing how much pain he was in. Our life was, for 16 years, our life was centered around sickle cell anemia. It was centered around pain. It was still centered around me being that parent that couldn't do anything to stop what he was going through. And as a mom, that was hurtful. And as a mom, that was you want to fix it. I'm a fixer. I wanted to fix everything that I could do, and I couldn't fix it. So I found a way. You have to join them. So I found a sickle cell community that was here. It was small, and that's how our foundation formed, because there was not a lot of support here in the Phoenix area, and I needed to see that change, not only for my family but for others. And when you can't, if there's not available for you, you have to make it for yourself. And that's what we did. And that's how the Kwame Lassiter Foundation, when it first started, it was the Lassiter Tackle Foundation. And we wanted to broaden it and open it up to sickle cell families. So we became the Kwame Lassiter Foundation.
And that's an amazing story. And your husband passed away when he was 49, right?
Correct. Yes.
How did he pass? Was it sickle cell related at all? Or?
No, not at all. Like I said, Kwame didn't even know that he was a trait carrier. We found out when I heard my first son, Kwame II, and he was tested. He actually passed from a cardiac arrest at the gym. So he was working out, very healthy man. And unfortunately, he had some issues with an enlarged heart. And that particular day was the day that God called him home.
Your answer really speaks to why we wanted Fran on here for our next segment, because screening and testing are just so important. And it's what we're hearing at the roundtables, the family sessions. If we would have just known, maybe we could have been more prepared, or just, to that degree. Quincy, how you doing? And I even have a question. Think of me as general community. I am not a chief medical officer like my partner Rob is, and maybe I'll bring Rob up here to the stage so he can speak to it. But what was then the bone marrow transplant? So am I hearing you say that sickle cell is curable, or what exactly? Can you walk us through what actually happened with you?
Yes, so it is curable, and like for the patient side or whoever's receiving the bone marrow transplant, it was more of kind of like a blood transfusion, where for me, I was laying in the hospital bed and hooked up to IVs, and they took the blood out, like siphoned it through a machine, and then the donor's bone marrow would come through another IV and would just flow throughout the body, and the doctors would just watch over me, make sure the body's reacting to the new cells entering the body. And then there, it's just a waiting game, and you just see if your body accepts the donor's cells. So for the patient side, I'd say it's not a lot of poking, I guess, that the donee might do, but it's still like mentally and stuff, it's still taxing on the body. But throughout the day, it was kind of easy process, just me and my family laying in bed and watching TV.
And how are you now? Would this be 4 years ago, or I forgot to look at the date on the. Or was it a while ago?
It's about 8 years ago, 2016.
Years ago. And how are you feeling now? I mean, so are you now cured of sickle cell?
Yes, fully cured of sickle cell. Still like to give back to the community through the Kwame Lassiter Foundation. And I'm feeling good. Just right now I'm in school, but like before, when I did have sickle cell, like I kind of missed a lot of school just because of the crises and like other stuff, always left class to use the bathroom or like go to the nurse if I was in pain. So like I guess quality of life whenever as like for a student or just a kid, I guess, you kind of miss a lot of school and work and you can't do stuff with your friends like recess. You couldn't really do. You had to watch your playtime because you didn't want to exert your body and cause a crisis to flare up. You couldn't swim, couldn't go from like cold weather to hot weather or vice versa. Like you just had to be careful the way you move because you didn't want to cause a flare up. And once the flare ups did happen, if you couldn't manage at home, you had to spend go to the hospital, and then at the hospital you can spend a lot of time there just until you're managed properly till the crisis goes down, and just make sure it doesn't come up again. So like that part is you got to do a lot to prevent it and take like the necessary steps to make sure you know what you're doing when these crises happen.
If you were to go back to those days of where that was top of mind to you, like, oh, I hope I don't, have a crisis. Do you feel like, what's the message that you would want to tell leaders, either school leaders or coaches, or like, were there people around you that just perhaps didn't value what you were going through? Or this session is all about telling the general public why they should care. So I'm putting kind of you on the spot before Mama, but you guys speak to that.
I would say from in my experience, I wouldn't say the people around me didn't value, I think that's what you said, because my mom and dad, they did like a good job prepping my teachers and like the school. Like I think they gave them a pamphlet of like what Sickle Cell was, that I have it, and like kind of like what my needs might be if something were to happen. So I feel like all throughout elementary school, at least, the people around me were very prepared. My friends knew, and then my brothers were always there to help me. So I feel like people around me always knew what to do if I were gonna have crises, and were always like watching out for me. And if I didn't have one, just to make sure if I'm okay, make sure I had water and stay hydrated, just so I didn't cause a flare up, because they knew what to pay attention to due to like my parents prepping them before the school year.
And I'll speak to the mom side of it.
Yeah, exactly, because Mama Bear.
Side of it is, and I saw both sides. So, he was protected from a lot because, as a parent, you advocate for your kid no matter what. And he's right. Back then, there were the pamphlets. There was not the Google. It was actually me printing them out and handing them to each one of their teachers and the coaches. I won't say they don't believe you in the school systems, because they were well prepared, and I didn't allow them to play with me or my children when it came to the care of my children. But on the coach's side, my kids that weren't sickle cell diseased were sickle cell trait, and they needed to have the same amount of preparation for their coaches. And there were times where, they're out in 100-degree temperature and they need water, and they were considered soft because they had to go get water. Well, that happened one time and it never happened again. And when you see people who have passed out, who has trait, who's passed away because they're outside working out, it's sadly that somebody has to go through that to get, the attention that's needed. And sometimes it may be the coaches that had no clue. But I wanted to make sure wherever my kids came, or anybody that was in the sickle cell family, that I knew that those coaches, those teachers, and everybody around them were prepared, so that we would not be in that number of people who didn't survive because they just didn't have a clue. And it just takes the advocacy, which is why, like I said, that's why I was in the hospital with him at Phoenix Children's Hospital. And at that time we had to share rooms. And I was fortunate enough to be with my kid. He never, even when he was 16 years old, spent a day in a hospital. I have a 23-year-old, never spent a day in a hospital without me or someone there with them. I've been in a hospital where families had to go home. They had to go to work. They had to rely on a nursing staff to take care of their families. And that's when the Kwame Lassiter Foundation said, okay, we have to step in, so that this mother has to stay here one day and she's afraid that she doesn't have the amount to pay her rent or pay her light bill, that she can stay with her child because I would want to hold a baby at night, and the nurses would say I can't because I'm not that parent, but I was there with my child. So those are some of the things that I that's why we formed our organization, is so that we could be there for those families, educate the teachers, educate those around us. He's cured. He's been cured for 8 years, but sickle cell still lives on, and we have to make sure that the families that still need us, that we're there to support. Because I promised God, if he ever healed my baby, nobody else will have to go through what he went through if I could stop it.
Well, you stopped it. You stopped. I just got to jump in here when we talk about warriors. I just want to start with Quincy. He got the right parents. You know, he got the trait from both, but he's got the genes. But he picked the right family to be born to.
Yes.
In the video I used, it's clear. I would not want to mess with Erica Lassiter on any issue where we disagree. She's an advocate. Before advocacy was popular or the trend or woke or whatever the hell it is now.
Yeah.
8 years ago when you did this, you were pioneers. You were taking a risk on a procedure that wasn't proven.
Mm-hmm.
You are so brave. 10 years ago, my sister had a bone marrow transplant for a rare leukemia at age 70. All right. She's alive today now. I wish she was 60, now she's 70. I got my years wrong. But the point is, to go through a bone marrow transplant, Quincy had to have enormous courage because his own immune system got knocked down and he could have died of an infection. And I don't call things a cure unless they're widely available to anyone of any means.
Yes.
Unfortunately, bone marrow transplant by some insurance companies for this disease are still considered experimental. And you got to have an Erica Lassiter fighting for you to maybe get it covered. So one of the pieces of advocacy is you have a potential cure with an 8-year successful outcome looking at us, talking to us right now. I'm a handsome guy. I want to recruit to work with us at Force for Health, to be honest with you. So well spoken and everything else, but that's another conversation. But you had a lot of courage to do that. Mom, you had a lot of courage, and you had a fight to get that paid for, I'm sure. But I want to bring up one other person, Bree Randall. Say her name, Bree Randall, your donor.
Yes.
She's in the band, okay? Yes. She randomly sees a sign, signs up, gets drawn, and then gets a call. In my day as a doctor, in the early days, of bone marrow donation was a painful, horrible torture of a procedure with multiple needle sticks into your hip, all right? You had more pain. Now it's a glorified blood donation. Is really all it is. It takes a while, but it's just simply a tube with an IV, a large bore IV, but it's a glorified prolonged blood donation, and it was wonderful.
I think as we look to, I'd love to bring Sarah, and I would love to bring Moses up to the stage for, roundtable discussion piece right here, right? As we close out anything. Sarah, Moses, questions or comments, or, let's kind of open this up. Why should the general community care about what sickle cell is? I saw this video on TikTok the other day, and it was calling sickle cell disease like if there could be a racist disease, it would be sickle cell, because it disproportionately affects brown skinned folks, and there's too much lack of knowledge and awareness out there. So you get kind of empathetic or implicit bias at frontline stuff, and we'll talk about that later. But Sarah,
Lucy, I would share, and so much what I've learned from Moses and everyone in the community, and I'm still like catching my breath from Eric and Quincy's. Your guys has me really emotional over here, but it goes around getting the message out there and reducing the stigma around this disease. I mean, I think there's still so much stigma around it, especially when patients try to get care in the ERs and they consider it med seeking. I think that's what is so important about this message, and thanking you all for sharing that, is how can we get out there, be vocal, get our voice out there, so that when we do have individuals that need the treatment, they're getting the care that they need at the right time and at the right place.
Yeah, that to me, Sarah, that's the biggest thing, is the stigmatism around it. Doctor mentioned it best, is that we took a chance, and I really don't gamble with my children at all, but I trusted God, and I did not want him to go into living life as an adult because he had sickle cell, because the care for children in sickle cell and the care for adults in sickle cell is 100 degrees different. And I did not want him to fight and not be considered a drug seeker and things that as soon as you hit that age where you have to go into adult care, when he was, I can't speak too much of how it is now, but I do know for being a part of Sickle Cell Foundation of Arizona, what they're going through, I had to be a part of that change. I will leave this earth being a part of that change and continue to speak on behalf of Sickle Cell Foundation. So Moses don't have to pull my arm or leg to do anything because I enjoy doing this. And I know people are waiting to speak, but I could speak for days about my experience and my experience alone. And I don't have to be a doctor just because I feel like by the time I started changing bandages, I felt like I was a doctor, nurse, everything else he needed me to be. I was that.
Erica, I have to speak to that just briefly. I hate to do this, Lucy, but it's true. Look at me. I missed it. I trained at the Mayo Clinic. In my medical school training in Chicago, I had one lecture on sickle cell in a biochemistry class about this cute little molecule. And then later one lecture about sickle cell as a disease. I spent 6 years at Mayo Clinic getting trained in pulmonary critical care medicine and didn't see a patient. Everyone looked Scandinavian in Minnesota. I went to Lancaster, Pennsylvania, did my whole career with people that were Amish and other people that looked like me. And one day in the ICU, some drug seeker patient, chronic pain patient, comes up to my ICU already intubated on a ventilator because they had some vague chest pain. It was a sickle chest crisis. I missed it. It took a medical student visiting from Pittsburgh to point it out to me. Should we consider that? This is a 40-year-old man. Wow. And so what I'm saying is I missed it as a doctor. That's why in that app, Moses insisted, and I insisted, we have stuff for professional development for the doctors. I want the school nurses. We have in the app the ability for a school nurse handbook as well for the school nurses. But we need to bring this down to the level of the coaches and the teachers, the ministers and priests and rabbis, whoever's seeing a kid in a school or after school program, they need to be on the front line. So and the patient and they need to ask your provider. If there's one message I have, ask your provider, could this be related to sickle cell? Remind the doctor in the ER, especially if they look like me.
Yeah.
And Rob is creeping into our third topic there. I feel like you went ahead and shot your shot there, but that's okay. We're gonna look to kind of close this out. I did want to share, a comment from Facebook coming in. Great work from Mark Morales, Erica. I don't know if you know him or not. That's wonderful. So Mark Morales, Market, is eligible for a little giveaway. If you are commenting on any one of the platforms, or you are commenting on key takeaways throughout this inside the app, you will be eligible for. Moses, what are the giveaways today? Are they Subway gift cards?
We have Subway gift cards that we're going to give away. Please continue to join. I want to just take a minute to thank Erica Lasita. I was fortunate to meet her husband, her late husband. That was really wonderful before he passed away. And I'm thankful that Erica is on the board of the Sickle Cell Foundation. She brings quite a bit. In fact, let me say this. When we receive financial requests from families, and Erica is part of our approval process, and Erica will be one of the first to see that financial request. Kwame Lasita Foundation would contribute. Let's say a family wanted to requested $500 or $700. And we say, oh, we can only afford $500. Kwame Foundation would come in and put the rest. They've done that many times, just as the Candlelighters Childhood Cancer Foundation of Southern Arizona. So I'm very honored and thankful to see Kwame and Quincy here today.
And I think as we again transition, I was so impressed by the fact that you've got sometimes it does take sports, right, to bring attention to it. So I'm going to finish this segment off by just showing the minute video on the Cardinals all coming together for your 4th annual. You've got an upcoming golf tournament, right?
Yes.
February of 2025.
Yes.
So let's go ahead and.
I'm out here at the Kwame Lassiter Foundation Golf Tournament, remembering Kwame and all the wonderful things he's done in the community. Of course, we all miss you. We love you. Let's have a great day on the course, celebrating Kwame.
Everyone feels like Kwame is your best friend because he made you feel that way. No matter who you were, he just had a big heart, and he was just a special individual.
Hey, Kwame, we're out here, man, supporting you. We're having fun. Man, we miss you around here, man. We're doing this for you, buddy.
Not only are we creating lifelong memories, but we're also competing to win. And we ain't get to take home the car, but we're going to win at the end.
Hey, we miss you. We love you. One day we'll see you soon, buddy. God bless you, dude. Deuce.
From the Lassiter family and the foundation, we just want to say we appreciate your support year after year. This is year number 4, and we hope to see you at year number 5.
It's getting bigger and better each and every year, and we're going to continue to make sure that 42 lives on.
Again, powerful stuff. Thank you so much for joining us. We're going to go ahead and get moving. You are free to stay in the back and watch from the backstage or go join the live link, but I'm looking forward to working with you. We want to train your whole foundation to be certified 360 SCD ambassadors.
I would love
so that we can just go ahead and help make that happen, and we'll play in the reality health games. Before you go, we had a Danielle Crudup also, come in and share her appreciation for your story. Love the story. Thanks for sharing. So again, Danielle Crudup is also eligible for a Subway gift certificate. Okay.
And Lucy, if I can share our gratitude to Erica and Quincy, sharing your personal story is not easy. And being vulnerable and talking about the struggles and calling things out that need to be called out is so important for us to move forward. And thanks for also teaching us, whether you're a mother, a friend, you can be an advocate in some way, shape, or form. And Erica, you are definitely the premier advocate that we should all strive to be. So thank you.
Thank you. I appreciate it. I enjoy it. If you ever need me again, I'm here for you.
Awesome. Quincy and Erica Lassiter, everybody. Look forward to working with you guys this year.
Absolutely. Thank you.
Take care. Okay, we knew that we were going to be running late here. Okay, let's go ahead and
you've got a full lineup here, Lucy. These people are really change makers in the community.
It really is, and that's why I love that I'm working with folks like you. I'm working with folks like Sarah, working with folks like now Fran, right? Altmeyer, actually coming out of the Arizona State, the testing lab that she is in charge of the newborn screening programs, and so we are going to bring her to the stage to talk about our next topic. Right now, this is living with sickle cell. So if you are living with sickle cell, or maybe you don't know, right? Maybe you don't know. So Fran Altmeyer, welcome to the quarterly Sickle Cell Advancing Together Roundtable.
Thank you so much for having me. Those are some tough acts to follow. Quincy's story is pretty amazing, and and a lot of that starts with newborn screening, right? Every baby who's born is screened for sickle cell disease, and there's no reason why any child shouldn't understand or know what their sickle cell status is anymore. And so I put together just a quick little slideshow to talk about what newborn screening is, so people who aren't familiar with it can understand a little about what it is we do for every newborn who's born, and it's regardless of what state you're born in this country. You are screened for sickle cell disease and or trait when you're born. And so we're going to talk a little about why screening, what is screening, medical home, and then a little about transition of care. So if you can move to the next slide, Lucy. So again, I'm Fran. I'm a pediatric social worker, and I work with the Department of Health Services, our Office of Newborn Screening, and I'm the manager for our follow-up program. So that's short-term follow-up and long-term follow-up. We make sure that every baby who screens positive for one of the things that we test for is connected with care. So we make sure that their providers know what those results are and then know what to do with those results. The next slide. So newborn screening, like I said, it's a public health service. Doesn't matter what state you're born in. We screen for rare but treatable conditions. There's a national recommended screening panel that mandates what states should screen for. Arizona is what's called a RUSP-aligned state, or the Recommended Uniform Screening Panel. So everything that's on that national panel, Arizona screens for or will screen within 2 years of its addition to that panel. So there's a strict nomination process. There's a federal advisory committee that reviews the best practices and conditions and treatments to see what should be included on these genetic condition panels that we screen for. Everything that is screened for, the best outcomes are when babies are treated prior to the onset of symptoms. Everything that's screened for has a treatment available for it. Those are some of the criteria to be added to this panel. Is there needs to be a treatment available. There are currently 38 conditions on the national RUSP, or recommended screening panel, and sickle cell is one of those conditions. So if you think about the thousands of genetic conditions out there in the world, there's 38 that are recommended that can be screened quickly and easily from a heel stick, that can be identified early before the onset of symptoms and have a treatment available. And of those, sickle cell is one of those. And people don't realize it. Everybody who's had a baby may know, gosh, my baby probably had their foot poked, but I have no idea what it was. I have 4 kids. Before I did newborn screening, I didn't realize they were tested for all these things. And even as old as I am, I reached out to the state I was born in, and I was screened for sickle cell when I was born. Back then, there were 2 conditions screened in New York State: PKU, which is where this all started, and sickle cell. So everybody should have been screened if you're, probably my age or younger, and specifically young adults now and children should know what their sickle cell trait status is. So let's move to the next slide.
Fran, I just want to jump in real quick. I have a 3-year-old and a 1-year-old, and it was very comforting to know that I would have information at my fingertips after the newborn screening, and how important, like, knowledge is power, so that you can, do the right things for your child. And a moment when, you have a child and the world is turned upside down, that was a really great service to have. So I just wanted to thank the state for the newborn screening program.
Yeah, no, you're welcome. And it's we want to make sure more people are aware. And I think Lucy uploaded to the app. We have 3 new educational videos that we just produced, because in addition to being Sickle Cell Awareness Month, it's Newborn Screening Awareness Month. And so we've started a campaign specifically for prenatal education, because you shouldn't be learning this for the very first time after your baby's born, that they're going to be tested for these things. You should be able to do your homework and know ahead of time. So this slide is just a little bit about the history. It's been up there if you've been able to look at it. It really was, we talk about the power of parents and parent advocacy, like Erica. And this was, this Dr. Guthrie. He had a son who had a cognitive impairment, and he really wanted to know why. And he was a scientist, and he made it his mission to figure out what it was. Turns out his son didn't have PKU, but he developed this test that has cured so many babies since the 1960s of this disease. But it starts with, parent passion and advocacy, and the determination to figure out how can we do it and do it better. So let's go to the next slide.
And I was just going to say, part of your website at the state, on your lab where these videos are hosted, there's a link at the bottom that shows the history, how one single test changed it. I have uploaded that PDF into both the 360 virtual library and the Force for Health Library, just for easy access, you
Yeah.
know? So
That's
again,
perfect.
cool.
Nice. All right. And so I already touched on this. You know, we're screening for 36 of the 38 conditions. We're in the process of adding the additional ones because we're still within that 2 years of addition. And so sickle cell, like I said, is one of the things that we're screening for. Positive results receive follow-up. Trait results are reported back to the pediatrician. We don't provide any active follow-up, but we're working to improve the messaging that we're sending to pediatricians. And another thing that we're doing to help with raising just the awareness of what your trait status is I think it's on the next slide. Every baby after they're born gets that blue lifetime immunization card. If you've had, I know, going back, my oldest is 26. I have his blue card still. And back then there was a little spot on the inside for did you have your heel stick done, but nothing about results. Later versions had the hearing screening results on the back. And then this current version, which was developed, I think in about 2018, 2019, just mentions trait status, but it doesn't even say what trait. So like, right, when you think about it, it could be any kind of trait. And we were really trying to say sickle cell trait. So after Moses and I had a conversation one day, I was thinking, you know, we should update the back of the immunization card to be more specific. So this new version that will be in print before the end of the year, I think they were just submitting this to print from the state. So every newborn probably at the first of the year or so will receive their blue lifetime immunization card. And on the back, it will look like this, where it specifically calls out, know your sickle cell trait status. And do you have sickle cell trait or not? And then if you have sickle cell disease, there's a place to write it under the confirmed diagnosis from your newborn screening. But we really wanted to know, you should know that you have the disease, but trait was a little more ambiguous, so that we really wanted to call that out, that people start the conversation of what's trait, do I have it, and I shouldn't be finding out as an adult that I have trait.
So this right here, I had to bring Moses up, okay?
Yeah.
When we talk about being a Force for Health hero, you know, there's levels. You care for yourself, you care for your family, you care about the community. You know, you might understand that there is an injustice or an imbalance, or maybe a way that you could do something better, right? This is a perfect example of a statewide foundation focused on sickle cell to work with statewide leaders to make something better, right? And so now you've got specific, do I just have a trait? Do I have a disease? So Moses, high five to you, buddy. That is
Moses is the most motivating man. You know, there's a lot of conversation in the newborn screening world about embedding parents into programs, because parents are your most valuable resource. And I can see in a lot of things where it feels forced to have the parents there because we're supposed to have a parent there, right? But when you work with Moses and sickle cell, there's nothing forced about it. He is a champion for the cause. He is motivating, right? You just want to work with him. And so I'm always honored to be able to help out wherever I can. And he knows that I'll jump in whenever he asks, because you know, of the work he does, and he's just so passionate, and it's contagious, right? We all want to be part of the help with him.
Well, and thank you for being a nimble enough entity from an agency level to want to hear input and then implement change. I mean, because it takes two, right? Passion,
sure.
but also like this is part of this advancing that Sarah was touching upon earlier. Awesome. Okay, I'm going to the next slide.
All right. So medical home, you know, we always talk about every person should have access to a medical home. And from the newborn screening program, we report all our results to that pediatric provider. Sometimes people will say, well, why don't you report it directly to the family? Well, we're just a glimpse in time for that family, but their pediatrician or their medical home is their ongoing provider. And we want to support that relationship between the family and their medical home provider. And so that's why we leave it up to the pediatrician or the medical provider to report those results to the family. We support that provider in knowing who to refer to, where to refer to, giving them resources, but it's really supporting that relationship between the family and their medical home in what to do next. So we communicate those results. They'll refer them to the specialist that they need for any follow-up care. And then understanding that sickle cell is a complex condition, right? It needs multi-specialty care. We want everybody to know that they can count on their medical home to be the one to make referrals to whatever provider it is they need for whatever body system needs support from this sickle cell disease. And every medical provider has access to a newborn sickle cell screening results. We have a portal where providers can log in and pull any newborn's result and know at their fingertips. And in those new videos that we developed, we're really encouraging families to have that conversation with their provider. Know what your results. No more of the no news is good news, right? No news is just no news. And really that misnomer of, oh, it must be fine because nobody told me. Well, did anybody look? So we really want to make sure that people are having that conversation and empowering parents to be the ones to start that conversation if their doctors aren't. So yeah, and then school, right? Moses and I were having this conversation, said, oh my goodness, at this time of year, I am overwhelmed with requests from high school athletes going to play in college because the NCAA is requiring proof of their trait status. Why are we waiting until college to know this? It's the same care that they should be providing to that kindergartner running around like a little kindergartner on a playground, right? I think Quincy and his mom talked about that, right? You shouldn't have to be asking. You should know and make sure that these kids are taken care of. You shouldn't wait till they have a crisis on the playground or wait until they want to play college ball. And then these kids are terrified to know, like, is this going to ruin my dreams of being an athlete? They should be knowing all along that this is to help keep them safe. And I've had to have that conversation with so many young adults and their parents that nope, they're not doing this to discriminate because that's their fear. They're doing this to keep their athletes safe out on the field. And then, the other thing with schools, I had come across recently, and I know you can't click on a link on a video, but if you go to the Raising Special Kids website, they have a whole article they just came out with about a chronic illness form that schools can use to help support students in their education when they're missing out because they're hospitalized, that there is a chronic illness form that they can complete to make sure that supplements their 504 plan or their IEP with their school. And again, involving the school nurses. I think that was the other direction I think Moses and I's conversation went, was in really talking about school nurses. We all fill out that little card that our kids can get aspirin or Tylenol or cough drops at the nurse's office, and there's a list of conditions, right? Does your child have asthma? Do they have seizures? But is sickle cell on there? Why isn't it on there? So really elevating that conversation of just talking about it. It's not a taboo subject. Let's open the conversation. And the more we see the words, the less scary they may be for people.
And on that note, let me just say, she wasn't able to make it on this particular deal, but we've been working with Lisa Alexander, who is the current chair of the School Nurse Organization of Arizona. In fact, if Moses is here, she has agreed to be on the Sickle Cell Foundation of Arizona board because we all recognize how important school nurses play, what role they play in being frontline and stuff. So I just bring that up quickly because school nurses matter, right? So back to your presentation. Sorry.
No, don't be sorry.
Can I just make a comment, please?
Yeah.
Sure.
Thank you, Fran. I love you, appreciate you, and I can't thank Arizona Department of Health Services enough for what they do in the whole state, and especially for the newborn screening. There are other partners, other CBOs in other states who do not have the kind of relationship that the Sickle Cell Foundation has with Arizona Department of Health. It makes so much difference. And of course, the Sickle Cell Foundation of Arizona receive Health Resources Service Administration grant, 5 years grant. And we work very closely with Arizona Department of Health to get that grant so that we can help to promote the newborn screening follow-up program. We are in our 4th year. There's a lot to say, but everyone who have appeared on this panel, in this event, has spoken more than I could say. It's great for me to just sit back and listen. So I just want to say this is awesome. This is wonderful. This is the education. We're just starting. Let me say it that way. There's so much to do. Thank you so much. Thank you, Fran.
Thank you, Moses.
This Awareness Month is a challenge to learn throughout the year, not a challenge to think today and then forget about it.
Exactly.
Okay? So go ahead, keep going, Fran.
All right. So the last thing I think I really wanted to talk about is how to find out your own trait status, right? Contact the newborn screening program in whatever state you were born in. Most have records going back for about the past 20 to 30 years. In Arizona, we do have results going back about 28 years. On our website, the aznewborn.com website, there is a patient request form. And so any person wanting to know their trait status or their newborn screening results can request those results. All you have to do is complete the form, submit it along with proof of identification. If you are a young adult athlete going to college and you've already turned 18, you have to request yourself. Your parents can't do it for you. I think that's one of the big questions we get from high school ball players is that their moms are making the calls, which is fine. But if you're 18, you have to fill out that form yourself. But I encourage people to start thinking about what's their trait status long before they ever need to know for school sports, for family planning, for whatever it is that you need to know for.
I think we should make a little badge at the 360 Hub, to encourage folks if they are curious.
Absolutely.
To go ahead and know. So on is this your last slide?
It might be.
Okay, yeah, perfect. Yeah, perfect. So my quick question for you, and let me just bring up, Taylor Francis. Awesome. Thank you for engaging. I think he was speaking to the cards, right? The immunization cards, which I think that's fabulous. Mm-hmm. And so as I bring up this next thing really quickly, let's just say you're beyond 28 years old. So you are 40 years old, or maybe you're a refugee coming in from an African country now living in Arizona. I want to check. What do I do?
That you would have to talk to your medical provider about. They can order a test to determine what your trait status is. That's something that it's an easy test that your medical provider can order. We're not able to do any of the testing on any babies that are over a year old at our state lab. So it's specifically meant to be for newborns. But there are hemoglobin tests available through your medical home provider.
I'm bringing Sarah and Rob back on as well, just because I know, Sarah, you are, frontline with the Medicaid space. And I think that Banner does a ton of work, even in the refugee space. And we've talked about this before. Did you want to make a comment on screening or capabilities within Banner at all?
I mean, it's so important. And Moses has educated us as well. And we work closely. Our maternal child health team, I know, works closely with those screenings. So thank you, Fran, for that. So we're definitely a big advocate for that. And you're right. We are, in Arizona, we do get a lot of influx of refugees. I know a couple years ago, we had influx of refugees coming in from Afghanistan. So we're going to have so many more populations that come in. And so it's great that we have tools like that you have there, Fran, at Arizona Department of Health, as we get new cultures and everything that come in, that they can also get educated and get those important screenings for those babies that are being born here.
And I wanted to just bring up this link. So I said that we had gone ahead and put into place the videos. So, there's a little quiz, how confident are you? But right now, these videos are all of 5 days old, right, Fran? And
yep, they are brand new.
there was a little press release. I mean, there's press release. And so we went ahead and popped them into the 360 SCD hub, because when you do that, then it'll actually track if you watch it, and I'll give you some points and get you eligible for some prizes as we try and incentivize engagement there. So let me just kind of take that off. But I think as a moderating host here with Courtney, we're going to make some executive decisions here and almost like morph this conversation into our last segment, you know, in terms of from school nurses to ER and why it matters frontline. Rob was speaking to it a little bit earlier, but before we kind of go into that, I also am going to pull up to the stage everybody, because this is a roundtable, right? And so I'm going to pull up Erica back to the stage. I'm going to pull up Crystal Jackson to the stage as well. I might have to take my overlay off to see everybody. Okay.
Lucy, please, are there any families, can you put it out there? Are there any families or individual with sickle cell who is listening in, viewing, taking part in this roundtable, in this event? If they do, please alert, we have some prizes. We're just trying to determine how many of you are out there before we announce the prizes.
And
Exactly.
Lucy, it's a perfect plug, right? To get your app out and start engaging on the app to get those prizes, or leave a comment so you can get one of those prizes.
Yeah, no, we appreciate that, you guys. And what's also interesting, there's been a couple comments coming in from Facebook. Let's see if someone just came in. MZ Kyla is in the house. So let's go ahead and make her eligible for a prize, and we will be reaching out. Easiest way is to just get inside the app, join it for free, say, hey, I watched this, and, you know, tell us a takeaway in the feed. It's just like a Facebook group, right? It's like a Facebook group that's connected in with a learning management system, and you can earn points and stuff. And so thank you for that reminder, Moses. And maybe we'll extend it, you know, perhaps through the end of the month, that if folks watch this and comment in the feed, then that giveaway can be eligible for those living with sickle cell. I think that would be great.
And hey, Lucy, I know I want to jump in real quick. I know we're coming up on the end. I wanted to give a shout out to my colleague, Crystal Jackson.
Exactly.
You know, at the beginning, we talked about building resilient blood supply. And one of the critical pieces is people like Crystal, who I see as our fierce advocate in blood collection. And Crystal, I don't know, I know you got to run and you've got kids and balancing a million things, but can you just give us just a really quick, how are we doing in Arizona on blood collection and diversifying the blood supply?
You want to come off mute?
Can you hear me?
Yes, we can.
Okay. So as month to date, we are, and we had some new numbers come in today, so I'm probably off just a little bit. But as far as Arizona, we are at 144 units collected, AA units. So we're going to probably either hit our target right on point, or we're going to exceed it. I'm sorry. Our goal for September is 150 AA units. And again, we're at 144 month today. I might be a little off. We had a meeting today and kind of went over some of those numbers, and I saw a couple of my colleagues jump up in AA units in our territories. Another thing I wanted to touch on was, I love the slideshow that just came up, because two things, 8 out of 10 African Americans don't even know, and people of African descent don't even know they have the trait. So 8 out of 10% of individuals that are of African descent, and the Red Cross actually grouped in people that are multiracial, don't know. So they put that number together statistically wise to say, hey, this percentage of people don't even know they have the trait. So I love that presentation that was just shown. And I actually met a gentleman a little older than myself. He didn't know he had the trait until him and his wife took his daughter to the hospital. And I believe he said she was around 12 or 13 at the time. And him and his wife looked at each other like, what's going on here? Like, how did she get the trait? And found out his father had it. So his father passed it down to him, and he passed it to his daughter. But again, I love that that presentation, because it is very important for us to know our trait status. And one last thing, that we all need to know as a community, not even on your trait status, but knowing if you're a match. So that's why it's very important that when we do go to these blood drives and we are donating blood, you're sharing your race, because you'll get to know if you have the trait, because we do test for that, but you need to mark your race, because as Courtney said earlier, 1 out of 3 African Americans are a match. So it's very, very important for us to spread that, to mark your race, because you get that 2-in-1. You get to know if you're a match, and you have those negative CEK antigens to be a match, or if you have the trait.
Thank you, Crystal.
You're welcome.
Thank you, Crystal. I just want to say that I have been having discussion with Fran, and of course, Sarah is going to be involved with that. We're looking at ways, initiative. How can we simplify, or not we, how can the testing, identifying of this threat be done in such a simple way, like they did with COVID-19? You can test it at home, that we don't want false positive or false negative. So that is the things that the initiative that we are going to be working on to see. Because as Crystal said, in the events that we've had, people have come to me, have no idea. They just say, I don't know what my trait status is. And they may be in their 40s or 50s or even 30s. So how can that process be simplified? Because not everybody has a primary care.
Right.
And it's a worldwide problem too, Moses. I know this is Arizona focused, and I cannot get over that the Arizona Department of Health Services gets a leader out of the lab to do a call like this, and all the support that you do, Fran. It's our tax dollars at work. Thank you. But I was on a call with a colleague in Africa who runs a school in Nairobi. Nobody's screened. Nobody knows. It's a worldwide problem. And I think by building awareness, we can raise the awareness, and it can be profitable for some company to get some contract from USAID and others to get a home screening, a simple screening at places that don't have a lab, that don't have refrigerators, that don't have Crystal Jackson there to be able to do it. I want to do a shout out briefly. I did it earlier, but I'm going to just throw it out there. I know I misunderstood when I saw a little thing go across screen saying we're running out of time. So I had to get my plug in there for school nurses. But there's Dr. Mom, like Erica or Lucy, that are looking after their kids. They're the first ones that know the symptoms. The husbands are usually at work or disinterested or afraid to deal with things like sputum or pain. Okay. Dr. Mom knows first. Oftentimes she's under pressure to send the kid to school. The school nurse is the first professional seeing the child, and will see the child. When I did a project with 500,000 students in an electronic school record in Pennsylvania, funded by Highmark Blue Cross over the course of about 8 years, it's 4 days earlier the school nurse knows the kid's sick before the pediatrician or before the ER. So making sure a school nurse knows. Second, the school nurse is a primary educator to the other staff in the school, the coaches, the counselors, the volunteers. So as we go and do our work, it's very important to support the School Nurse Association and their work in getting the word out, because the school nurse is the Crystal Jackson in the school, is the person in the community, is the Erica in the family space. Erica, with your golf outing, I apologize, but I hate golf and I have physical limitations, so I will not be at your outing, but I will donate to the foundation. Anyone watching this, you can write a check. You don't have to be a golfer to donate to that foundation.
Thank you. You can come out and hang out with me. I don't golf, but I have a good time. So you can come hang out with me if you want to join us. For
Erica,
sure.
sign myself and Crystal up for that. We would like to come hang out with you. I don't golf, but I can drive a golf cart really well.
We'll put you to work. We'll put you to work. And I will just say, Doctor, that definitely school nurse. I had him as a favorite saved on my phone. I expected a call almost every day after Quincy got to school, got through first period, that he would make a trip to the nurse. The medicine was in there. It was to the point that she would try to send him home all the time. Then I'd be like, put him on the phone. I made sure she knew that he didn't have to come home every time, but she learned the difference of when he just needed a little boost or when he needed to leave. So I appreciate every school nurse that we had. In fact, when one left, I was very sad, but yeah, the school nurses are very important. And I support that organization.
Nancy Lopez got my kids through. Thank you,
Yes.
Nancy. But
Yes.
the key thing with the school nurse and with others, as we do advocacy, all of us, is that when a child is a little sleepy, when a child is not themselves, when they seem spaced out, it may be pain, it may be pain medicine. They are not disinterested. They are not bored. They are not bad kids. They are struggling to just exist in that damn classroom.
Yeah.
And the teachers have to understand that and make special allowances for that as well.
Absolutely.
That's all.
And can I throw in one other thing that school nurses have access to is the Arizona American Academy of Pediatrics has the Medical Services Project, and school nurses are the only ones that can make referrals to that program, which will provide funding for medical specialty care. So child needs hearing evaluations, vision tests, orthopedics, any type of medical evaluation, and they don't have insurance or access to medical coverage, the school nurse can make a referral to the Medical Services Project and have that covered. So it's a really good resources for families that are under or uninsured to be able to access medical care that might be financially prohibitive.
Please send Lucy or I a link to that program. It is not in the app right now, and it will be as soon as we get it.
Well, it's only it has to come from a school nurse. So
I understand.
That's
I understand.
okay. Perfect. Yeah, absolutely.
But we're educating school nurses.
Yes, absolutely.
I guess, when we converted this to like a private, broadcast to, no, let's just share it with everybody because it's on LinkedIn and everything. I knew that we maybe should just keep it at 2 hours because we easily can fill 2 hours. I figured we didn't need an in-person networking, so I shortened it to 90 minutes, and now we are at 93 minutes. So right here, I'm going to play timekeeper and moderator, and Rob, I don't want to minimize who you are and what your role is, although we've been talking about this the whole time, right? Dr. Rob Gillio is based in State College. He is a retired, pulmonologist, and he acts as our chief medical officer and was very involved in the development of the 360 SCD Hub app as well. So, and of course, he's our main competition, Arizona people. We have all Arizona people on right now.
Yeah.
Rob will be leading My Healthy Pennsylvania and Penn State into many
The
challenges.
most important thing on that graphic, and on the graphic that's on the screen now, is the QR code that's on the screen. Anyone watching this, you're hearing about this app. That's an easy way to get to the App Store to find it. That was the most important graphic on that last slide, I think. Honored to be here.
So team, I think Arizona showed up. And Moses, we praise you because you are the connector of all these incredible people, and we are here under your wings to help you fly as you want to aim high, as I've heard you say so many times. So let's go around the room right here. And I might start with Fran, and I want a 1 minute recap, last thoughts, and we'll close it up. Fran.
Wow. I guess I think I've gone over it all. Know what your trait status is. Know that newborn screening is testing every baby who's born in this country for sickle cell disease, as well as sickle cell trait, and know to communicate with your pediatrician to find out what those results are. Thank you.
Awesome. And so great to see Arizona Department of Health in the house with us. It's awesome.
Thank you, Fran.
Erica.
Sickle cell matters. Sickle cell was part of my family for such a long time, and sickle cell matters. We are going to stand up for ourselves and make sure that everyone else has the awareness that we have to support our families.
Mm-hmm. And I love the legacy that you carry with your husband in so many different health-related but youth-focused and engaged here in Arizona things. I really think there's an opportunity for you guys to be certified ambassadors for the 360 SCD Hub through the Tackle Foundation. So I'm going to train you on that. Sarah, from the healthcare space.
From the healthcare space, at Banner Plans and Network, we're just honored to be part of this and sit on the board with you, Moses, and be able to share everyone's voice and get it out there, not only in Arizona, but even nationally, of how important it is to reduce the stigma of this disease and just, again, get our voice out there and about this great app that we have, all these resources to connect all of us.
Rob, 1 minute.
Everyone ask this question. If you're a patient or even if you're a doctor, could this symptom be from sickle cell? That's it. Put it in your mindset. That way it can be recognized and taken care of with kindness, support, compassion, or the appropriate medical care, depending on the setting. Thank you.
Moses, I'm going to hold on. Crystal.
Me, it's my turn.
Yep.
I would say roll up your sleeve and help the Red Cross close the gap, because everyone deserves the same customer service when they go to the hospital. And someone used a quote that I never thought would stand out to me until I saw a picture of myself with my 4-year-old son. And the reason I'm so passionate about this is it could have easily been me or one of my kids.
Awesome. We go to Moses.
Wow, this is a great event. I'm thankful to everyone who is here. I just want to say to Dr. Rob, I'm a doctor dad, joining Erica.
Good.
I usually don't talk about all the detail of what my experience is with sickle cell. But because it's not about me, I don't like to give sad messages. I like to be positive and uplifting. I appreciate Crystal out there in Phoenix. She's very passionate, and I could spend all the time talking about everyone. But I want
we have
to
Akila. We have Akila watching online, and of course, she is our front line, right? Community health worker.
Yes, our community health workers out there. Yes, community health workers in Phoenix, Mark, they're all watching. Akila and all the warriors. Please don't be ashamed of sickle cell. If there is one word I can give, do not be overcome by the stigma. Overcome the stigma by being positive. Love yourself. You love yourself, you can take care of yourself.
And I apologize earlier for not recognizing the name. Mark Morales, of course, the community health worker for the Sickle Cell Foundation up in Phoenix, and of course, Akila Gilbert down here in Tucson, both as extended team and support leads for the Sickle Cell Foundation of Arizona. And a trusted partner, Courtney.
Hey, final remarks, Lucy. Thank you so much for the Force for Health for bringing us all together. Dr. Moms, Dr. Dads, all of you out there, I was reminded that this isn't one person's job, it's all of our jobs. And it takes a collective group coming together with a shared vision and a shared goal. And that's what we have here and what we need to continue to advance. People are still suffering with sickle cell disease, and our sickle cell warriors know firsthand that the pain doesn't stop, and neither should we. So it's our job to keep pushing the needle forward. Thanks, Lucy, for hosting us.
Lucy, please let me give a shout out to our caregivers, the hospitals, the nurses, the social workers, the educationists. So many of them are making a difference, sacrifice. They're like the firefighters. When there is fire, serious fires are running into danger every day, every hour. See these nurses and doctors running into pain and suffering and lifting up the lives of many of our friends and neighbors, people you know and people you do not know. I give them a shout out.
And, it was incredible to be at Banner when you gave 28 awards to doctors, nurses, PAs, educationists, etc., because of your gratitude of what role they play. Phoenix Children's Hospital and Banner are the core of our metropolitans here, and we'll see a majority of those families. And so the relationships, the connections and support and the intersectionality of all of that is wonderful. My final thoughts are, this is not a one and done thing. right? I've been working with this group for a year. We've been able to do quarterly roundtables, family conferences, medical awards. It is a continuing conversation because the stigma is real. People living with sickle cell still feel stigma, and we have to erase that. And so I'm going to kind of keep fighting until I feel like I'm hearing from the group that, okay, you did it. We eradicated stigma in the SCD space. So this is an ongoing thing. Thank you for the Sickle Cell Foundation of Arizona. You do monthly empowerment meetings. Again, the app is free. Download it. It's the easiest way to connect with this ecosystem of people that care about sickle cell.
Monday Empowering Group meeting taking place tonight at 6:30.
Tonight.
On us. Yes,
that's right. Tonight at 6:30. And another plug for you is, last week in Tucson, you guys hosted a movie night for the families living with sickle cell in Tucson. And on this Saturday, to round out the month, there is an invitation to have a free family movie night on behalf of the Sickle Cell Foundation in Phoenix. And so, everybody plays a role in population health. Know your role. Own your health, know your blood, move your blood, and give your blood. That's going to be the mantra of this 2024-2025 season that we like to call Reality Health Games. So heads up for these teams that will be coming up, and you'll be able to support the Sickle Cell Foundation of Arizona. You'll be able to support the Kwame Lassiter Foundation, and we'll be able to play virtually and then in person in May in 2025. So download the app, 360scdhub.org is the website. And partners, thank you. Till next time.
Thank you.
Thank you.
Howell and Courtney Sloanacker to kick it off. Thank you for joining our broadcast. We hope you have found some value from the information we provided, no matter what role you play in the sickle cell disease community ecosystem. Together, we can aim high and increase awareness and support for sickle cell while reducing the associated stigma that still exists at the same time. We invite you to connect with us at www.3stscdhub.org,